Hello, Dr. James Bogash, expert in health and longevity, and very interesting study out of Japan looking at a little over 1,000 hospitalized patients. But this really drives home what I've been saying since the beginning of 2020, the pandemic, where what was driving COVID was very clear that poor metabolic health was on the top of the list above and beyond everything. That doesn't always mean that somebody is obese. It just means that they have poor metabolic health and that fat sometimes can be sitting somewhere else. So I've mentioned many times over the years that BMI, body mass index, is not always the best indicator of whether or not somebody's metabolically healthy. It works wonderful from a population standpoint, but when you start drilling down to it, a bodybuilder who's otherwise lean and takes good care of themselves may have a high BMI, but it doesn't mean they're at risk for anything. And so when we looked at BMI alone, sometimes we didn't see a good association with COVID outcomes. But when we looked at metabolic health, it was a very clear association. Despite this, 4 years later, we are still not talking about improving metabolic health. We're talking about the low-hanging fruit that nobody is offended by. So arguing wearing a mask, vaccination, Pavloxid, any of those different approaches, those are all easy. Lots of people make money on those. Nobody makes money on people taking better care of themselves. So it is the less exciting direction to go, but with the most payout. So what was interesting in this study is they looked at people who had a chest CT for where the fat was sitting. And we all know that visceral, you can have subcutaneous fats, you can have fat buried just under the skin. You can have fat in the muscle, which is not good. You can have fat around your abdominal organs. You can have fat around the heart. And these all have varying degrees of evilness, if you will. And the epicardial adipose tissue, so the fat around your heart, is probably the worst of the worst. It's generating these chemicals right in the heart, right in the coronary arteries where we don't want inflammation to be happening. And so when they looked at people so the chest CT scan can look at abdominal fat versus, specifically upper abdominal fat versus the heart fat around the heart. And what they found is that the people who had the more fat around the heart were at the highest risk of critical outcomes with COVID, 266% higher risk of bad outcomes with COVID. That's not to say that the abdominal fat was not an issue, because it was, but not as much as looking at the fat around the heart. Couple other interesting things from this study is that BMI, I already mentioned, BMI is not always a representative of how much abdominal. So somebody they could be really lean everywhere and just have abdominal fat, and their BMI may be okay, not considered obese, but it's still a problem. So in this study, they found that 41% of people who were not obese had high visceral adipose tissue. So that is, we just missed 41% of the people that are actually at risk, but were not considered at risk because if we just looked at obese. And yet it put them in the high risk category. So very important to understand that metabolic health and making good choices is the most important player, both 4 years ago and 5 years ago and 20 years ago and in 20 years. It is still the most important discussion we need to have. But the authors, just like everything else in our drug-dominated society, their conclusion was maybe we should find some therapeutic target, drug, to affect the inflammation around the heart so that COVID won't have as bad of outcomes. Yeah, we have that therapeutic target. It's called lifestyle changes. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.